Okay, our last presentation is Dr. Fakher elmasrey from the USA. He's going to talk to us about aorto-iliac occlusive disease. Welcome.
I would like to thank the organizing committee for inviting me. And also would like to send my condolences to the Vascular Surgery Society for the passing of Dr. Essam 8 weeks ago. Big loss, great vascular surgeon, dear friend, and just a fabulous human being. My topic today is it showing? Yeah. So it's covered in the vascular reconstruction of aortic bifurcation, this year up. So these are my disclosures. So everyone in this room is aware of the open repair bypass, and subsequently kissing stents came later on. Aorto bifemoral bypass obviously has higher patency, 75 to 95%, 10 years. Kissing stents are much less invasive and has a lower patency. First kissing stent was done by Tegmeyer at University of Virginia in 1985 and followed by Kofer and Palma's 1991. So there are still limited data. The patency is lower. But you could treat complex aortic disease. There are two trials, the Cobes trial and the Humphreys trial, showing the superiority of cover stents over bare metal stents. Self-expanding stents versus balloon expandable, also the accuracy of balloon expandable versus self-expanding bare metal stents. Then came the PTFE cover stents. The first one was the Atrium. They have the ICAST. After that, the barred live stream and the Gore Biobond. And there are limited use of also endografts for aorto-iliac occlusive disease, basically the endologics. So basically, in any stent, you want to have the combination of strength and flexibility. The ICAST trial, which is the ICROS, showed superiority at 3 years. Then that was followed by the live stream, the Bolster trial. I was part of that trial myself, 2013. And they have the smaller caliber of 6 French. Literally until last week, the Gore VBX just got FDA approval for the 6 French VBX literally last week. And I thought that they're going to use a smaller wire to increase the French size, like what they did in the Biobond, but it's still over an 035 wire. So the Flex trial for the VBX, and the usage of endologics, the unibody AFX. I personally don't use the AFX anymore on aneurysmal disease, but this is my graft for occlusive disease. And these are the couple of papers by Maldonado, single center in 2016. The syrup concept came afterwards, where you do a 3-stent technique. You stent the aorta and then 2 kissing stents into the aortic cuff. And this syrup technique also is a safe, feasible alternative to open surgery. Aorto-iliac occlusive disease, it's important to know that 1/3 of all the patients with peripheral vascular disease, they have a component of iliac or aortic disease. And the role for stent graft basically has been shifting over the past couple of years, where there is more endovascular treatment versus open surgery. The Society of Vascular Surgery guidelines also recommend endograft for risky patients. The indications are like any other indication: ischemic disease, claudication, recurrent of bifurcation, and instant restenosis. The test classification, I'm sure everybody knows about. And there is a shift in this diagram from the past decade, where it's now we're moving more towards endovascular versus open for aorto-iliac disease. Post-procedure management, it has been mentioned by previous speakers, dual antiplatelets and follow-up in 6 months. And I'll go over a couple of examples in the past 3 minutes. So 60-year-old patient with PID, tobacco, hypertension, hyperlipidemia, with severe buttock pain, and this is the CAT scan. If you see down all the way to bifurcation, you see heavy calcification. If the scan will go a little bit faster. So we proceeded with access, femoral access, and you see that high-grade stenosis in the distal aorta. And in this case, we went ahead with AFX in the Logix, which is a unibody. Second patient, 60-year-old with history of tobacco, diabetes, a smoker, presented with great toe amputation. And the CAT scan also shows high-grade stenosis of the aorta and calcification. Those are the cases you don't want to place a bare metal stent where you could end up in ruptures and complications. And in this case, we proceeded with also an AFX. Actually, no, this is a case where we has this total occlusion, we recanalize the left common iliac, and then after that we place the AFX endograft. 66-year-old female, aortic stenosis in the infrarenal, ischemic rest pain. Here we did a hybrid procedure, so you see the cut down on the femoral for a femoral under aortectomy, and you see stenotic lesion in the aorta. And in that case, we placed a cuff of ovation, which is another endologic product. 64-year-old male, heavy smoker, complaining of bilateral leg pain, left more than right. I'm trying to run this video, but actually it's not playing. This is an unfortunate 35-year-old obese female with hypercoagulable protein C and protein S, and Berger's disease, and bilateral amputations. I had to do this whole procedure from an arm approach. As you see, very small arteries, and I was trying to increase the blood flow to the stump. And as you see here, there are stents in the aorta. All what I wanted to do is increase the flow to the hypogastric. So I went through the stent. This patient had a failed right to left fem-fem, and I just wanted to recanalize and stent the left common iliac to be able to increase the flow to the hypogastric, which was done successfully. And the accuracy of these stents are really critical. My last case, 63-year-old smoker, hypertension, infra-aortic disease, and we ended up just placing a VBX in the aorta, and then putting 2 VBX stents into that. One final case, we always think that the surgery is end all. This patient already had surgery, and if you see patient has aneurysmal dilatation of the, I think my time is up. I'll just show the last image. Basically, patient has aneurysmal dilatation of the aorto bifemoral graft, and we're able to go and put a VBX stent to seal the aneurysms back into the aorta, and we placed 2 VBX stents. And sealed the aneurysms back to the anastomotic stenosis. Thank you very much.